The following video is about specific learning disability. Does your child experience any learning problem, struggle with school? Do they dread reading out loud, writing an essay, or tackling math? Learning disabilities or learning disorders are umbrella terms for a wide variety of learning problems. A learning disability is not a problem with intelligence or motivation. In fact, most children with learning disability are just as smart as everyone else. Their brains are simply wired differently, and this different affects how they receive and process information. This prevents a person from learning a skill and using it effectively. Learning disorders generally affect people of average or above average intelligence. The disorder appears as a gap between expected skills based on age and intelligence and academic performance. While every kid has trouble with homework from time to time, if a certain area of learning is consistently problematic, it might indicate a learning disorder. The types of learning disability involve problems with reading, writing, and math. The most common of them is problems with reading, as 70 to 80% children with learning disorders manifest difficulty in reading. The term used to address this difficulty is called dyslexia. A reading disability can affect any part of the reading process, including difficulty with accurate or fluent word recognition, or both, word decoding, reading rate, and reading comprehension. Difficulty with math is also known as dyscalculia. A math disability can cause difficulties in learning math concepts such as quantity, place, value, and time, and difficulty memorizing math facts, difficulty organizing numbers, and understanding how problems are organized on the page. The term dysgraphia is used to address impairment in written language ability. It manifests itself as impairments in handwriting, spelling, organization of ideas, and composition. For an early identification and intervention, it is beneficial to educate ourselves of the signs and symptoms of learning disability. The signs and symptoms for preschool children include problems pronouncing words, trouble finding the right word, difficulty rhyming, trouble learning the alphabet, numbers, colors, shapes, or days of the week, difficulty following directions or learning routines, difficulty controlling crayons, pencils, and scissors, or coloring within the lines. Signs and symptoms of learning disabilities for children 5 to 9 years of age include trouble learning the connection between letters and sound, unable to blend sounds to make words, confuses basic words when reading, consistently misspell words and make frequent errors, difficulty telling time and remembering sequences, and slow to learn new skills. Signs and symptoms for children 10 to 13 years of age include difficulty with reading comprehension or math skills, trouble with open-ended test questions and word problems, poor handwriting, dislikes reading and writing, avoids reading aloud, poor organizational skills such as bedroom, homework, and desk are always messy and disorganized, and trouble following classroom discussion and expressing thoughts aloud. The prevalence of specific learning disorder across the academic domains of reading, writing, and mathematics is between 5 to 15% among school-age children across different languages and cultures. Moving on to how specific learning disorders are assessed. It is a process that involves a variety of activities and procedures intended to ensure a comprehensive set of data for determining an individual's present level of functioning and needs. It includes procedures to determine levels of performance in domains such as motor, sensory, cognitive, communication, and behavior. The areas assessed include listening, speaking, reading, writing, reasoning, mathematics, and social skills. However, the assessment must focus on the presenting problems and possible correlates. Data is obtained from case history, interviews, and direct observations. Standardized testing may include intelligence test, achievement test, language test, and visual motor integration tests. Curriculum-based assessment is also done. Information and data collected during the assessment is used to formulate the intervention plan. You should start with your child's school, and if they are unable to help you, ask your doctor or friends and family who have dealt successfully with learning disability. The types of specialists who may be able to test for and diagnose specific learning disabilities include clinical psychologist, school psychologist, child psychiatrist, educational psychologist, developmental psychologist, neuropsychologist, occupational therapist, and speech and language therapist. Sometimes, several professionals coordinate services as a team to obtain an accurate diagnosis. A learning disability can be diagnosed at any time. A child may be diagnosed during early childhood. For some people, it may be many years before they receive a diagnosis, while others may never receive a diagnosis at all. So now let's discuss the factors that can serve as a cause of learning disability, also known as risk factors. Family history and genetics. A family history of learning disorder increases the risk of a child developing a disorder. Prenatal and neonatal risks, poor growth in the uterus, exposure to alcohol or drugs before being born, premature birth, and very low birth weight are linked with learning disorders. Psychological trauma. Psychological trauma or abuse in early childhood may affect brain development and increase the risk of learning disorders. Physical trauma. Head injuries or nervous system infections may play a role in the development of learning disorders. Environmental exposure. Exposure to high levels of toxins such as lead has been linked to an increased risk of learning disorders. Don't hesitate in seeking help from a psychologist if your child needs extra support. After all, every child is special.